When we were embarking on our last strategic plan, we started digging into local data and looking at the health issues of our community, and tobacco is one of those pieces that's holding our community back. And for Northern Kentucky and Kentucky as a whole, smoke-free policy really is the biggest thing that needs to be tackled, or at least the first thing that needs to be tackled when we're talking about tobacco.
We are employers, we raise our families in the communities, we live, work, play in that area. So as we move forward, having a healthy, vibrant community is extremely important through a smoke-free ordinance.
Unfortunately, our data is still showing that tobacco use is the most preventable cause of death and disability and disease that we have in Kentucky and the United States. And so the health department's very concerned about that, because our goal is for our region here in Northern Kentucky to be the healthiest in the nation.
We do see so many patients presenting with lung cancer, which is a grave concern. 90% of all lung cancers are caused by cigarette or tobacco use. From a St. Elizabeth perspective, I think we're trying to operate at both ends of the spectrum, reducing smoking so that we don't see the cancer to begin with, but now that we do have a generation of smokers, addressing those issues as quickly as we can.
The coalition goal as Breathe Easy started in 2019 with a focus on a smoke-free ordinance, specifically in the workplace and in public spaces throughout Northern Kentucky. The coalition exists of several members who we greatly value. Our funders are Interact for Health in St. Elizabeth, both who have provided incredible support to the effort over the last several years in particular. But we also worked with the Kentucky Center for Smoke-Free Policy, the Northern Kentucky Health Department, the Northern Kentucky Chamber, and several national growth organizations. The American Cancer Society provided incredible support, as well as the American Heart and Lung Associations.
Dayton and Bellevue are in the middle of a renaissance. They're vitalizing and revitalizing their area, and the residents there are interested in having smoke-free air, and there's visionary leaders that see the future for what it is.
Dayton was the first policy target, and they really have been a more progressive city. They passed the fairness ordinance not too long ago, had a newer mayor that was progressive and interested in moving Dayton forward, looking at that revitalization. And then Dayton and Bellevue sit right next to each other. And so I think that it was just a natural progression. And now as the work continues, really trying to stay in Campbell County. And so we can continue that momentum and build that support at the county level.
Our coalition had many members who had personal relationships throughout those two communities, and we worked really hard on educating them, answering all of their questions. Regardless of the type of question, we would get back to them and be really responsive, and had a long-standing establishment of trust with those partners.
We identified residents and businesses who would be supportive of this. And we knew it was extremely important that council members, the mayor, the city attorney, the city administrators, all heard from their businesses and area residents about how important the passage of this smoke-free ordinance was. We were able to do that through a grassroots effort, through direct mail, through geo-targeting, social media, combination of a campaign that helped us identify people who would be supportive. Nothing replaces the personal ask, and there was quite a bit of that from the coalition. We asked the coalition to dig deep into their networks. Who did they know in Northern Kentucky, in those particular cities, who could influence, who would be willing to share their voice, maybe even show up at the meeting and say a few things.
Make sure you have a very broad-based coalition so that if one or two members or factions drops out of the process, you really have a strong team to continue, because you do have to be very persistent and just very fact-based, and it takes time to build the trust with leaders, rightly so, to make major changes like this.
With policymakers, the message frames that seemed to resonate the best was the focus on the workplace and the health of the worker. Anywhere in a public space or in a workplace where employees were present, being able to prohibit smoking provided a benefit to workers who may not have had a voice in the retail setting, be it a bar, a restaurant, etc. Many people say, well, that worker could just leave a job. In some cases, in many cases, that's not true. And so as we brought workforce statistics forward, the policymakers understood that for the good of the community, the smoke-free ordinance was the right direction to go.
Depending on the policymaker, it could be that they were interested in the worker health piece. We had another policymaker that was very interested in the impacts that other communities saw from secondhand smoke policies. And that particular policymaker was also another individual who was on the fence until right before the vote. And they had been asking questions around the effects of the policy for other areas. And with help from the Center for Smoke-Free Policy at the University of Kentucky, we were able to provide them a very concise comprehensive policy impacts list where they were able to see those data points and what happened in the other communities that had passed smoke-free policy. And for that particular stakeholder, it was key for them to see that there had been positive effects in the community from other folks passing smoke-free air ordinances.
The other piece was the personal advocacy that each of the coalition members provided. The chamber, through their advocacy efforts, definitely was able to meet with the council folks with a common narrative, a consistent narrative, so that each policymaker was hearing the same message. They may have had different pushbacks, with different parts of the ordinance itself, but they were hearing the same message from us.
I think that we have a ton of data that shows us that tobacco is a problem, that smoke-free policy will have a positive impact on our community, but we have to bring that data to life, and storytelling is one way to do that. In Dayton, there was a couple constituents that showed up to the meetings. We had one lady that was pregnant, going to be raising her family in Dayton, and she wanted it to be a smoke-free community so she can go anywhere with her child and not have those concerns. We had another resident that was a bartender, and he'd previously worked in Chicago when they went smoke-free, and he was able to tell the story of how everyone was very concerned that it was going to impact the business, and we actually didn't see that.
And we were able to find the courage of several elected leaders in Bellevue and Dayton who had the will to bring this forward to the community, get the council support, and pass the ordinance. Both mayors were known entities in our community. They have taken on complex issues. They've shown great leadership skills. And so beginning that conversation with them was a continuation of many conversations members of the coalition had, whether it be the chamber, our group through the One NKY Alliance, the health department, all were familiar with the courage and the leadership that both cities exhibited.
We organized a group of, One NK Alliance, the chamber, and the health department to go in and meet with the elected officials, answer their questions, meet with the mayor and the city administrator so they could really walk through the details of the policy, what enforcement would look like, answer any questions that they had, and then start to build that base of support from there. So really starting with the mayor, city administrator, and then building off of that.
We had a lot of questions around health effects and what we saw with other policies that had been passed in Kentucky and throughout the nation. There were a lot of questions about enforcement of secondhand smoke ordinances and how that works. And we were able to provide information around those areas because we were in constant communication with them and made sure that our door was always open for them to be able to ask any question and get a quick response on that as well.
I think what the coalition did well was strategically we approached this. We had the funding in place, thanks to St. E and Interact. We developed a strategy, and we followed that strategy until it wasn't the right one. And that brought in the flexibility side, which was extremely important. When we went from county focus to city focus, that was a definite change in our direction, in our timing, and that came through the agreement of the entire coalition.
One of the things the coalition did very early on in the process is develop a list of key messages, and we were all able to stay on message and on point about the work that we were doing in the community and why we were doing it in the community, and the message stayed consistent no matter who you were talking to. We were also very open with our communication, constantly communicating about where we were as a group, and we brainstormed if there were any concerns or issues that needed to be addressed and how to handle those. And so really, I think our collaborative process was probably key in our work and moving forward.
I think when there is the ability to have funding that allows for a person to be paid, I think that can be really impactful. You know, many of the coalition partners and the people showing up every month and doing the work have a lot of other job responsibilities. They can't focus on this one project solely. And so having someone that was keeping all the balls in the air and making sure that things weren't dropping, I think was a huge component to moving this effort forward.
It takes a lot of patience, and if you work and you're providing information and education and it just doesn't look like it's gonna happen, stay focused and know that there may be an opportunity in the future for you to come back to this again with your policymakers. And so patience is probably one of your biggest key pieces. And don't go at this alone. There are other individuals in the community that are interested in moving this forward, and it really does take every different sector of the community.
When a community is going after any policy change, and definitely smoke-free policy, I think building that grassroots support early is really important. It can't be an afterthought. Elected officials like to hear from their constituents. They want to know what the people that are voting for them care about. And so building that grassroots support, getting people on board so that you have this base of people to leverage when the time is right is really important.
We do see examples from across the state and the Commonwealth, such as Louisville, where they've had these ordinances in effect since 2008. And last time I was in Louisville, I see a vibrant community full of restaurants and bars and people enjoying those venues. And so we know that these ordinances will encourage people to visit Dayton and Bellevue and check out all of the great things happening in those communities.